Good afternoon, ladies and gentlemen. I hope everyone's doing well today. My name is Janani Srikantharajah. I'm a program coordinator at Prevention Institute. Has anyone in this room heard of Prevention Institute? Oh, that's lovely. So Prevention Institute, for those of you that don't know, is a national nonprofit. We're based out of Oakland, California, and we were founded about 14 years ago out of the recognition that there were a number of organizations looking at health way after the onset of illness and injury, but not too many organizations. In fact, our executive director would probably say no organizations that were looking at building the practice and momentum for the field of primary prevention. So before I get into where prevention and public health show up in the Affordable Care Act, I just want to spend a minute, literally a minute, talking about what I mean when I say primary prevention. And you'll hear me go back and forth between the term community prevention and primary prevention, and that's because those of us in this field have started to talk about community prevention as a more precise way to get at the concepts I'm about to talk about in the next 10 minutes. So prevention is a systematic process that reduces the frequency or severity of illness and injury, and specifically, primary prevention is what we're interested in, because primary prevention is about addressing the community environments, the places that we live, work, learn, and play, to keep people from getting sick in the first place, so to keep problems from occurring before the onset of symptoms. Now, I just want to point out here that prevention is used as an umbrella term, and it does encompass quite a few things. So clinical prevention falls under the term prevention, and that is not what I'm talking about here. Clinical prevention includes things like vaccinations, immunizations. Primary prevention includes things like health education. So health education is giving people information about how they can quit smoking, how they can eat healthier, how they can be physically active in a safe way. That is primary prevention, and so you can see why it's important to us to make the distinction between primary prevention and community prevention, because when I talk about community prevention, what I'm talking about are the changes that we make in community environments to do things like give people access to healthy fruits and vegetables where they might not have had access before. Ways to create spaces that are safe for physical activity where those spaces may not have existed before. So that's what I mean by community prevention. The examples that people tend to be familiar with are around tobacco control. There are a couple good examples in traffic safety, things like car seat legislation, seatbelt laws, those types of things. I'm in a very fortunate position to be standing here today and to tell you that community prevention has far more support than we have ever had in the 14 years of existence at Prevention Institute. This is a quote from President Obama before he was elected as president. So we have some high-level federal support for community prevention, and President Obama and a number of people in the White House and in Congress did support community prevention before the election, during health reform advocacy, and today. Interestingly, I think community prevention was one of those topics that was bipartisan and has now become a bit of a partisan discussion. But that's a conversation we can have during the Q&A if you are interested in that. We also see a tremendous amount of public support. 73% of the American public supports community prevention. This is the most recent polling data we have, and it's from December of last year. But we've consistently seen that the public does seem to have a better understanding of community prevention today, and that there is support for prevention within the Affordable Care Act. And research shows that the environments where people live has a tremendous role in shaping health outcomes. And so we actually can see in this slide that 70% of the determinants of health are related to community environments, so the places where people live, and health behaviors. 20% of the determinants are genetics, and 10% are medical care. And yet, if you compare that to national health expenditures, what you see is that the bulk of health expenditures, and the key here is that these are federal dollars that are dedicated explicitly to health, are spent on medical services, and there's about 4% spent on prevention. That total number for health expenditures is actually lower than it is today because that's from 2 years ago. And these numbers haven't changed much with the passage of the Affordable Care Act. I'll just make that point. And even if you dissect that prevention number, what you would find is that the bulk of that 4% is in clinical prevention, so things like vaccinations and immunizations, and not so much in the type of community prevention strategies that I just described. So we have a lot of work to do, a lot of work to do. That said, there's also something to be very proud of today, which is that for the first time in the history of the United States, we see federal investment in community prevention through the Affordable Care Act. So Title IV of the Affordable Care Act is for prevention and public health. And as part of Title IV, there are a set of provisions related to clinical prevention, which I will not be covering, and there are also some provisions for health education, which again I won't be covering. But the Prevention and Public Health Fund, which is probably the most exciting part of Title IV, is that pot of money for prevention. And as part of the Prevention and Public Health Fund, we have these grants called the Community Transformation Grants. And the Community Transformation Grants are grants that are available to states and locales around the country to develop a comprehensive set of strategies through collaborative efforts to change community environments. Other exciting things in Title IV are the National Prevention Strategy. The National Prevention Strategy is exactly what its name says. It's a national level strategy for community prevention. More than guidelines or guidance for what community prevention looks like, I like to think of it as a framework for community prevention. And this strategy is open to public input. It's gone through 2 iterations, public iterations at this point. I think we're waiting for the next iteration to be released. And it is possible for you all, for everyone, to provide input on these. The strategy is being developed by the council, which Karen introduced us to a few minutes ago. This council is, it's an interagency council, so there are representatives from major cabinets, executive cabinets, and this is really cool because I think there's a recognition that health is determined by more than healthcare services. And we have representatives from agencies like labor, agriculture, sitting at the table talking about how they can coordinate efforts to support community prevention. And it's headed up by the Surgeon General. And then there's this advisory group, which actually came together a couple months ago, and their first meeting was the last 2 days. And the advisory group advises the council on things related to the strategy and a few other initiatives. So these are the major elements, I would say, related to community prevention within the Affordable Care Act. The Affordable Care Act sets aside about $15 billion, exactly $15 billion over 10 years for prevention. And you'll notice at the end of your slides, I've included 3 slides for those of you that are interested in numbers, which I won't be covering, that show how the $15 billion is going to be spent over 10 years, and fiscal year 2010 and 2011 appropriations. And I really like this slide because I think it drives home the point that the Prevention and Public Health Fund is a tiny sliver of the entire health reform pie, a tiny sliver. And still we're so excited about it because this is a type of investment, it's a type of innovation that we've been working for about 15 years. And we think that it has the potential to really show returns and show outcomes in terms of better health outcomes within communities. That said, it's also, we're fighting to keep it alive. And I think we just saw the 3rd attempt yesterday to repeal the Prevention and Public Health Fund. The House of Representatives passed a bill that would eliminate the mandatory funding for the Prevention and Public Health Fund. And at the same time, I'm happy to report that the President did issue a statement saying that he is in full support of the Prevention and Public Health Fund. And by chance, if both the House and the Senate pass bills to repeal the Prevention and Public Health Fund, he would veto it. So we're hoping that stands, and there's a lot of work to make sure that this fund does stay alive. So just honing in a little bit more on community transformation grants, I've included a little bit of language that comes directly from the Act. And the important thing here, I think, to point out is that these grants are available to address chronic disease. So the community change efforts that communities will be eligible to apply for grants for need to be focused on improving healthy eating behaviors, increasing physical activity, or reducing tobacco use. And that's because chronic disease is a major driver of healthcare costs. It's 75 cents of every dollar spent on healthcare. And so the goal here is that by focusing on the environments that lead to chronic diseases, that we'd be able to not only improve health outcomes, have the greatest impact in improving health outcomes, but we'd also reduce costs. I just got my 0 minutes mark, so I will make my last point, which is that prevention in public health is an investment in innovation. There's no doubt about it. And there are a couple other investments in innovation. And I think that as much as we're going to be spending the next few years defending the Prevention and Public Health Fund, we also want to build on the seeds of innovation that this legislation has afforded us. And Prevention Institute recently came out with this report, Community-Centered Health Homes, which builds on the concept of health homes that's been around for a while, to identify ways that healthcare institutions can become engaged in community prevention. Today, as a country, when we think about health, healthcare institutions are, for the most part, the healthcare sector, for the most part, is what we think about. And still what we see is that healthcare institutions don't really have a process or a systematic set of methods to engage in community prevention. And that's really what we tried to outline and begin to lay out in this report. And you can see, these are the recommendations. I actually have a couple versions of the report, and you can access this on our website if you're interested. All right, thank you very much.